There are two mechanisms that cause this posterior glide fixation of the sacrum, and one is delivery of a very large baby. And of course, during pregnancy, there's softening of the ligaments of the pelvis, and it's reasonable that that could be one cause. Another common cause is a fall in the buttock in which the SI gaps open and the weight of the upper body pushes straight back right through the SI joint and wedges it posteriorly. And my client Catherine recalls a fall on her bum. And when the sacrum is posteriorly, it shifts your center of gravity. If you could imagine standing but putting your pelvis backwards, and it throws off your whole body, and then you have to hyperextend throughout your spine and even in your upper cervical spine to compensate for that. And we treated her very simply. This posterior fixation of the sacrum is a pattern I've discovered. It's in my writings, but it's not in the body of literature. The way I treat it is I put 3-inch foam underneath the pelvis with the patient laying on their stomach, and we'll demonstrate with Catherine in just a minute. And we do this for 5 minutes to allow the ilia to glide backwards and let the sacrum just gently sink forward. And then after 5 minutes of laying like that, then I place a piece of foam and I lean onto her sacrum. And we treated her very successfully. I'll demonstrate the motion in just a few minutes. And when the sacrum is wedged posteriorly, it certainly is pulling on that pelvic floor. And it's also pulling on the sacral nerves. Those would have excessive tension, and that certainly can add to pelvic floor dysfunction and pain. Before I demonstrate, I'll ask you how you feel. You just got up and walked around, and you've been smiling, and you're sitting. Tell us how you felt walking and how you feel sitting now, but keep your face out of the video. Just
when I started walking, I just felt much lighter, more, I want to say youthful. I am in my late 40s, and as I walked, I felt like there was so much more movement and sway in my body versus walking very rigidly. And I've noticed, especially when I sat down, which sitting was very difficult to sit without having pain. It's almost etched in my memory, and I'm sitting here without any pain, and it's almost like my mind is playing tricks on me because my mind is trying to remember the pain, but the pain really, it's not there. I'm sitting just fine.
beautiful. Nice. I'm very happy for you. Can you come lay on your stomach and we'll demonstrate the treatment?
Okay, lay my stomach this way.
So I took 2 pieces of foam, and I like this foam because it indents a little bit. It's not rigid. It gives a little bit and conforms to the body. So I placed the foam under each side, and you were on that for 5 minutes. And after that, I came and put a piece of a foam block right over the sacrum, and I just leaned my body into the table so I could stay here forever, and I just leaned with my forearm very gently, probably 15 pounds of force, and I just leaned like this for 5 minutes. And in response to that, the position of the sacrum has changed. If you want to come around and film from that side. So, when I find the PSIS and the sacrum, they're almost in line. My fingernails hit. And when I try and spring the sacrum, I can take up the slack. And I can push, and there's movement happening down through the legs. Okay? She had blocked mobility going superiorly, and that corrected in response to that treatment. And let's have you lie on your back, please. And now we have mobility on the right side. Good. Well, we're off to a good start. I will have you just do whatever you do regularly today.
Okay.
You know, don't do anything unusual. And we'll bring you back tomorrow and see how you're doing, and we'll evaluate whole body.
Okay.
And I'll teach you how to keep this motion.
Wonderful.
Nice. Thank you.
Looking forward to it.